Hello, I'm Dr. Michael Teplitsky. I'm a medical doctor practicing internal medicine, alternative holistic medicine in New York for over 30 years. This is part 3 of our discussion about low thyroid. It's a very common condition. Millions and millions of people have it, especially women. I explained why in part 2. So watch it if you want to know why women primarily suffer from low thyroid. I explained also what the symptoms are. They have to do with the fact that the cells do not get the right amount of energy, so they all become sluggish. So the whole person becomes tired and weak, gets tired easily, cold, constipated, depressed, and poor memory, heavy menstrual flow, all kinds of problems. Today we're going to talk about how do we diagnose low thyroid. To repeat, low thyroid is a situation when you do not have enough thyroid hormone. Your thyroid gland is not making enough thyroid hormone. In part 2, I explained to you why that happens. Today, we'll talk about how do we figure it out. Let's say you have the symptoms, you go to the doctor, and they want to know, do you really have low thyroid or not? So they do a blood test. What do they check? They check your thyroid hormone levels. There are two main thyroid hormones. One is called T4, T for thyroid, 4 for the number of iodines that you have in the T4. T3 has 3 iodines. The active hormone is T3. T4 doesn't do anything. It's just sitting there waiting to be converted into T3 to start working. Most of the thyroid hormones are not free. They are stuck to a certain protein. So a small amount of the thyroid hormones is free, but the bulk of the thyroid hormone is not, which is why we have tests like total T4 and total T3, and we have free T4 and free T3. Now, to make things a little more complicated, there is another hormone called TSH. It stands for thyroid stimulating hormone. It is not made by the thyroid. It's made by the pituitary gland in your brain, and it stimulates the thyroid gland. It's like a whip. So let's say you have a horse who's not running very well. You take out a whip and you make it run faster. Well, TSH does the same thing for the thyroid. So when the thyroid is fine, when it's working normally, the TSH level is very low, practically 0. But if the thyroid starts slowing down, TSH level starts rising. And there is a discussion, a disagreement among doctors when the thyroid stimulating hormone is too high and when it's time to treat. So in many labs, they say normal is from 0 to 4.5 or 0 to 5.5 even, I've seen. But it turns out that 95% of normal healthy people do not have TSH above 2. It really shouldn't even be 2. I mean, it should be very low if your thyroid is working normal. Okay, so you have thyroid issues, you think you have weight gain and dry skin and you're tired, and you go to the doctor and you say, hey, maybe I have low thyroid. So what do they check? They check TSH and they check total T4. That's all. I think that's a mistake. When people come to me, I check everything. There are about 10 different thyroid tests that we can do, and I check all of them because, I mean, one can be okay and the other one will show that there is a problem. But this is what normally happens. You go to a doctor, they check your TSH, and let's say your TSH is 4. Well, they say that's fine. TSH of 4 is fine. I just told you that actually it's not fine. That normal TSH ought to be under 2. But the laboratory says up to 4.5 is okay, up to 5.5 is okay. And then T4, it's the one of the thyroid hormones. Normal T4 is between 6 and 13. Okay. What does that mean? What is your normal T4 supposed to be? Nobody knows. So let's say if you normally you're 10, and now you have all these symptoms and you're 8, you're still normal because you're between 6 and 13. You're in that range. So the doctor says, you're fine. There's nothing wrong with you. Go home. And you don't get the help that you need. So that's where I come in. If you have problems that are suggestive of low thyroid, if you have tiredness, sluggishness, if you're cold, if you're gaining weight, you have dry skin, constipation, depression, hair loss, give me a call. My office number is 718-769-0997. 718-769-0997. I've treated literally tens of thousands of patients with low thyroid over the years, and I can help you if you have this condition. We can run a blood test. We can do anything that is necessary to figure out what's happening. So call me 718-769-0997. Don't forget to tune in for part 4, where I'm going to talk about how to treat low thyroid. Until then, I'm Dr. Michael Teplitsky, wishing you the best of health.